In this lecture, we will be taking a closer look at some applied examples as they relate to our previous lecture on social change. This first slide connects you with what Shirley Better is proposing in terms of 4 important techniques for improving not only social change, but the kinds of policies that people, groups, individuals, communities are implementing in order to help facilitate that change. She looks at things in terms of a personal level, things that we can do ourselves, individually, even psychologically, and then things that can be accomplished at a group level. The group level of intervention and change is something that does connect with professions, as I said before, and community organizations. There is a handout that will accompany this lecture, and it's important that you take a closer look at this as you're considering some of these applied examples. The first applied example is going to relate to cross-cultural counseling. So it's bringing together, in this case, the world of counseling, the world of psychiatry and psychology, marrying that in a sense with greater cultural awareness and some of the particular kinds of questions we can ask ourselves, and then some of the particular kinds of applications that we can do as community organizations and as professions to be able to reach people from a wide variety of cultural backgrounds. When you're looking at your handout, one of the first things that will appear, it's really on the first page of the handout, is a self-assessment tool. It's a series of questions that you, as the future counselor or as the current counselor, can reflect on to understand your own individual growth as it relates to cultural awareness. And of course, as that cultural awareness relates to the service that you're providing the local community. So, self-awareness, self-assessment, these are important concepts that Shirley Better brings across in her model and her discussion. Some of the questions that a person can ask themselves, number one, what are the ways that cultural differences between a counselor and a counselee affect the process of counseling? So are there barriers, in a sense, and what barriers may relate to culture or may relate to maybe some sort of predisposition as it relates to a culture or perspective regarding a culture. Another question that is part of this self-assessment, how can counselors evaluate their own cultural biases? So what particular kinds of stereotypes does a counselor have? How does that impact the service that they are providing? What kind of self-related bias exists within the counselor's mindset? And how can that be either overcome or compensated for in some way, shape, or form? Other questions included, can we assume that all counseling is to some extent multicultural in nature? And if so, how is our service reflecting that? What is the evidence that professional counselors are culturally conditioned in terms of their responses? Responses in this case to the feedback that they are getting from their clients. So if a client is experiencing some sort of at-home crisis, maybe substance abuse, maybe depression, maybe there is domestic violence in the home, is that framed in the same way? Or is that framed in such a way as to incorporate or include a cultural awareness regarding relationships and marriage and family as it relates to that other culture that you might be servicing? So pause the video here or pause the lecture at this point and reflect on those 20 questions. Think about what kinds of awarenesses, individual and group, can be fostered by reviewing these particular kinds of concerns and questions. And of course, this just relates to the idea of dealing with clientele from a wide variety of cultural environments. So those 20 questions help with some of the basic assumptions that we can relate to this notion of multiculturalism in counseling. There are a great deal of social relationships that may be present in any instant, any event that we need to be aware of. We need to realize that social relationships do vary across cultures as well. And any confounding factors, anything that might be creating a bias or some sort of barrier in terms of the service that you as the counselor are providing, must in some way, shape, or form be addressed if we are to improve our strategies and if we are to be more inclusive as a result of those improved strategies. The next piece to the handout that you can reflect on is or relates to what is known as a triad. A triad design is taking a real world example and then dramatizing it. And in a sense, considering what the counselor is saying and thinking, and then ultimately what the client is responding with and thinking at the same time. What you will find in this example is that you have a variety of unseen characters at work. So as you look at this triad design, as this dramatization, what I'd like to initially do is give you some background with regard to the client. This client originates in Southeast Asia. They are an Indo-Chinese refugee. There are, in a sense, four voices that you will see dramatized in this interaction. We have the counselor, a male counselor, a white male. We have the Asian American client, in this case an Indo-Chinese refugee who is transitioning to life in the United States, also a male. And then inside the mind of the client, you have an anti-counselor and a pro-counselor. And what I want you to do is take a look at what the anti-counselor and pro-counselor are communicating to the client as he is interpreting what the counselor is saying. So that's a good starting point for understanding bias and understanding communication as it relates to cross-cultural contexts. The idea relates to this notion of when I say something and I am speaking from outside of a particular cultural environment, how is that being received? What can I do to modify that? Or is there an understanding that I can foster individually to be able to, in a sense, overcome that kind of bias and that kind of barrier? In other words, when I have these competing views existing within one communication environment, how, as the individual, either the client or the counselor, but I think more of the responsibility in this case lies on the shoulders of the counselor, how do I, as the counselor in this hostland environment, how do I create a unique individualized strategy for my client? So pause the lecture at this point and read through that dramatization. Think deeply about the messages that are being conveyed within the mind of the individuals and reflect that or relate that in a sense to the communication process and ultimately the kinds of questions the counselor is asking as part of this larger kind of professional strategy. Another area to consider relates to healthcare. Healthcare is a subject that we all right now, in the midst of this pandemic in 2020, are experiencing. And ultimately, these kinds of pandemics, as is the case with natural disasters and national policies, these bring to light inequalities and structural sources of discrimination. In the World Health Initiative, the World Health Organization, for example, and organizations like it, they have engaged this notion of dealing with pandemics, dealing with health issues, public health issues across cultural lines. In the field of nursing, there is a specialized area of work known as transcultural nursing. In fact, many nursing programs have their own coursework on transcultural nursing. So, where does it all fit? Let's take a look at it broadly, and then let's consider it in relation to a very common health condition across the globe as it relates to children. What is transcultural nursing? Well, it's a specialization within medical anthropology and within the nursing field. There are two general perspectives, though, that are at work when we're talking about any sort of transcultural consideration. First, anthropologists, by their nature, are not interested in the well being of people and diseases. In fact, they take a non judgmental, detached approach toward understanding, in this case, health and sickness. However, when you connect that detached awareness with an applied profession like nursing, now we start to get more of the kind of applied anthropological approach. Nurses, in this second perspective, are very much focused on diagnosing and treating a sickness or some sort of medically relevant condition. Nurses are also extremely interested in how people naturally or biologically respond to some sort of external stress, but then also how the culture itself, when you bind the two together, how the culture has some of its own adaptations to dealing with health related stress in their communities. So, bringing together, in a sense, the academic, the anthropologist, with a professional in the field, the nurse. The nurse who is traveling outside of their homeland environment to a new hostland environment, a place where they are not the majority, but ultimately they are working with people who are a majority and who are of a different cultural background. So it's basically public health nursing, but on a global perspective. The Russell Sage Foundation in the 1950s really pioneered this connection between anthropology and nursing. In fact, they invited anthropologists from across the globe to discuss human health in the 1950s. In 1968, the Council on Nursing and Anthropology was formed, the CONAA. This was an important point in the history of this partnership because it brought the concerns of both together and it actively challenged individuals in this group setting to now engage health on a global scale. We realize, and again, pandemics are very good examples of this, that health concerns in one area of the globe are not isolated to that location, but they are literally a species level concern. And so the views and values that we may have regarding public health in this country must be connected with and made compatible with a variety of views, similar views, across this patchwork of cultures. Well, let's look at some research. Research, in a sense, is another one of these areas where the work of the anthropologist, the work of the sociologist, and the work of a professional, a field professional, can come together. And one global topic that we have seen this partnership really flourish with and benefit from is otitis media. Otitis media, or OM, a disease of the middle ear which now has been studied in a variety of global environments. So, how has this condition flourished across the globe? Well, this is an inflammatory disease, meaning it is something that generally will be a biological response to an infection. Infections are things that challenge our species, again, globally. When we're talking about OM, this inflammatory condition associated with the middle ear, it results in things like fever, for children generally who are experiencing this more than any other demographic across the globe. It will result in behavioral variation or fluctuations, irritability, but then it will also be reinforced by things like ear pain. And if untreated, it can result in hearing loss. Across the globe, we see OM impacting male children more than other young people or adults, generally between the ages of 1 to 3 years. Now, what do we know about children and parenting? Um, well, we realize that if we're dealing with some sort of inflammatory condition, an infection, for example, and there's a specific demographic that is more at risk, we have to look at care as it relates to this demographic across a variety of cultural environments. One of the things that a lot of field workers treating OM in the field have realized is that there's a strong connection with alloparenting. Now, what is alloparenting? Well, alloparenting is when you are sharing parenting throughout family networks or social networks. And unfortunately, these networks, this shared responsibility for parenting, can be a great avenue for any sort of infectious condition, a virus, a disease, or in this case, some sort of practice which results in an illness. This practice can easily work its way across these parenting networks. Research has found that the incidence of OM increases by 50% when children are cared for outside of their nuclear or extended family household. And so this becomes a global condition in the sense that more people go to work, you have more working individuals within families, and you are having more community-based organizations being responsible for the care of children. Daycare would be a very good example of this. So with an increase in working mothers, for example, across the globe, and working fathers across the globe, public child care has also increased, and this condition of OM has also, in a sense, in a parallel fashion, increased with it. It is not caused by it per se, but one is definitely connected to the other. There is a correlation between the rise in more public forms or non-family based forms of healthcare and OM as it relates to the generations being raised currently. Correspondingly, with the early advent of weaning in many cultural contexts, especially those that are experiencing a change in their approach toward labor and toward work and how that is affecting family structure. These early weaning expressions are also connected to a rise or an increase, or they are correlating with a rise or an increase in OM. What researchers have found across a variety of medical contexts, including research in sociology and anthropology, is that the antigens that are present naturally in mother's milk have been recognized as a kind of natural medicinal preventative device for this condition. And so you can see with an increase in OM, and the correlation that it has with earlier weaning practices as they relate to changes in labor patterns and changes in the home, there has been this increase in this vulnerability. Where are we seeing it currently? Well, today in developing world environments, places like Angola, Liberia, Nigeria, we are seeing a rapid increase in OM for these very reasons. We are starting to see the roles played by men and women in the home and outside of the home change. We are seeing the impact of global markets and global labor strategies that are being superimposed in these developing environments, how these are having an effect on health concerns. And so it's important on a global scale that we start to compensate for this, that we start to educate, and that we start to provide resources for parents that might push back against things like early weaning. We may work with, in this case, employers and markets that are imposing new labor strategies to emphasize the need for allowing mothers, for example, in these environments where we're seeing an uptick in OM to be able to continue to breastfeed. What does it come down to? It comes down to cultural awareness. It comes down to retrofitting a health plan to a developing world environment, to a cultural environment where you may have a different tradition that needs to remain in order to push back against some of these inflammatory conditions and diseases. Nutrition, breastfeeding, pregnancy and diet. Considering things that are not necessarily pharmaceutical or surgical, but things that are there in the culture that can be supported and emphasized to be able to push back against this uptick in disease and in illness. But in situations where you don't have that luxury, then bringing an awareness of pharmaceuticals and preventative kinds of medical treatments early in that dialogue to be able to provide families, parents, with the means to prevent this kind of disease. And if it does emerge, giving them the awareness to have it treated early enough so that there is no hearing loss. So early discovery, the symptomology associated with it, antibody detection, testing, and antibody treatments. These are all things that health professionals can provide. But it takes that group level awareness that Shirley Better is discussing in her primer to be able to exact public social change that contributes to health improvements, not in just one developed or developing context, but across the globe. Consider these examples as you're completing the readings that you have regarding the primer. Compare what Shirley Better is saying to some of these subjects, even subjects that you might be dealing with in your own life. How can you, on an individual level or a group level, reduce bias and increase awareness and inclusivity?